and a physician from South Korea. I focused on hair loss and tinnitus treatment of Dodge using PRP and pulmonary script as well. So I'm going to present today about regional treatment for hair loss and tinnitus using PRP and pulmonary script. If you still have some more questions at the end of this presentation, you can send me email. My email address is in Palanos. The cell visualizable text monsters, right? But in my clinical data shows that Improvant itself may continue for years after the end of last treatment. Okay, here I'm going to show you my real clinical data. Are you ready? I'm going to show you five cases first, and the whole data later. This is first acute sensory loss cases. He has very severe performance loss, and three vision first, second, and 3 times, and he only got normalized. You can see the full detail later in this chart over here, right? And this is the second case. This is not the current case. He was suffering for several years, nose-induced hair loss and tinnitus. And we added one neurosurgeon for his case. And after 1 month, his area got improved. The tinnitus was gone. This is real case here. You can scan here to see the real case. And this is Cesarian hair loss case. After 3 weeks later, he came to my clinic, and I injected several times. After 1 injection, only slight improvement was seen, but after 1 year later, end of my treatment, more marked improvement was seen, and he came back after 4 years later. In his 4 years later, he came to my clinic, and his hearing got completely normalized. Because this is real case because you can't destroy if you want to see a full day. And this is unidentified chronic cases. Visits first and several times PRP and pulmonary scripts. And after 8 times of injections and after 4 months, his hearing completely normalized. This is real case. And this might be less. No, one more case might be waiting. This long-term hearing recovery, this bilateral case might from 45, and 2 years later, he became structured decibel and left 65 to structured decibel, nearly normalized. Yes. So hearing improvement can be achieved and it will persist even after end of treatment and even after several years. So by combining these 3 cases, all we can see is that the average speed of improvement is around 30 decibel per year, and the aging is around 1 decibel per year, right? So you can apply this treatment for anti-aging presbycusis, remote sensing in hearing field. Okay, this is has very significant meaning. And this is the last case this is my case. So while I'm preparing this presentation, I suddenly got hair loss. Yeah, I'm my best dressed. And first I tried to get a steroid treatment, which is traditional way of treating this way of disease, and it results in only got worsening my hearing. So I asked my physician friend to learn this procedure and treat me. And after 3 sessions of PRP treatment, my hearing got back normal. This is my case. So I am a doctor and a patient as well. So today, for the first time in this conference, I'm going to show you my recent data publicly. Are you ready to see? Yes. Hearing threshold improved after PRP treatment. Significant every frequency was significant. So literally every frequency, from low frequency to high frequency, all the frequencies showed improvement. And not only acute cases, but also chronic cases showed significant, statistically meaningful improvement. So improvement was not only acute, but also chronic. And even after more than 10 years of symptoms, patients got improved. Yeah, it's real. So there are three key findings. I'm going to close my presentations. Significant recovery at all frequencies, and chronic cases also improvements, so it can apply this for anti-carrier field and benefit parties across symptom durations. So there are 50 million patients awaiting interventions for doing this treatment in the United States alone. And this is still very old field. When I first made this treatment in 2015, and that was patent, there was no clinical publication, and around 4 or 5 years later, still no publication paper. It really dark period, and I was very alone. And still now, only 19 very primitive publications in the world. That means it has a huge opportunity, right? So, if you are not any physician who is interested in cannabis treatment, you all have to learn how to make right to disclose the window and how to use the response. And your treatment gets standardized, and it means you can get reproducible treatment, and you will be licensed. So, any physicians who is interested in my Kenya's clinical know-how and want to get famous attended first, just scan this QR code. This address is Colorado/Vegas. It is not just a protocol, but make the whole result reproducible